Thanks for joining us today. I'm Sam Boyk and this is Mile High Living. If you struggle with burning pain or tingling in your feet, Front Range Medical Center's chiropractor can help offer a scientific approach that addresses nerve pain and reverses your symptoms. Dr. Dean Anderson joins me to share how he can free you from peripheral neuropathy. Great to have you back on the show.
Good to be here, Sam. Yeah.
Now, what is peripheral neuropathy?
So peripheral neuropathy is damage to the peripheral nerve. So these are nerves in our extremities. Most commonly, it'll affect lower extremities, start off in the feet. As it progresses, it can work its way up towards the knees. It'll also affect upper extremities, so starting in the fingertips and then again working more proximal up towards the wrist. So it's damage to those peripheral nerves.
Okay, and what causes peripheral neuropathy?
Yeah, so there's a long list of causes, and most people associate it with blood sugar problems. Now, diabetes, even pre-diabetes can cause neuropathy, but other metabolic problems, liver problems, kidney issues can cause neuropathy. Chronic inflammatory problems or autoimmune issues can cause neuropathy. It can also be side effects of certain medications. There's a number of chemotherapies that are known to cause neuropathy. It can be side effects of statin medications, chronic use of antacids. There's a number of reasons, and that's part of the key in the beginning is getting a good sense of what's driving it and why patients have it.
Yeah, what are some of the things that patients have been dealing with?
And usually when we see patients, they've had neuropathy for quite a while, and there's a lot of frustration for two reasons. Number one is what they're dealing with from a symptom standpoint. A lot of burning, sharp shooting pain, a lot of numbness. So because of this, patients have issues with mobility, being able to be on their feet. So taking walks, enjoying activity with the grandkids, being able to sleep at night. Oftentimes nerve pain is worse at night. Balance is a really big issue because of numbness, having a difficult time knowing where our feet are. So a lot of frustration because of symptoms, and it's progressing. It's getting worse over time for a lot of patients. They're tired of just taking medications to manage symptoms. Traditionally, patients are put on gabapentin or Lyrica, but it's just kind of managing symptoms. So there's a lot of frustration about the continued progression as they're doing everything they know to do.
Sure, and if it's not treated, are there any long-term complications that could develop?
Long-term complications are kind of the things we're talking about, just lifestyle, pain, and just not being able to enjoy things you like. A lot of patients come in the office and they worry about, the worst case scenario of amputations, and that's a issue for some, but that's few and far between. But those are things that patients concern themselves with for sure.
Okay, you offer an advanced treatment, so what is your approach to peripheral neuropathy?
Yeah, so we do a treatment in our office that's electrical. It's the most advanced form of medicine. It's a newer technology to treat nerve symptoms. So we see significant reductions in that burning, sharp-shooting electrical pain. Patients who have numbness start to regain feeling. We do some ancillary therapies as well to help increase circulation. A lot of times we have to increase blood flow to the nerves, just helps with that healing process. And then the other aspect of this that's very important is making sure we understand what's caused it. Like we were talking about earlier, your blood sugar issues or inflammatory problems, and we address those issues along the way. And Sam, this is really the only way for patients to get to the other side of neuropathy, is a comprehensive approach where you're addressing the nerve damage and symptoms, you're addressing blood flow, and you're addressing the underlying cause to why they have it.
Okay, well, if you are experiencing any of these types of symptoms, we want you to give Dr. Dean Anderson a call at 720-881-9749 for a free consultation, and you have many happy patients, so let's hear from one right now.
I'm exceptionally grateful to Dr. Anderson and his staff for the wonderful care. They're really amazing, wonderful caring people, and the therapy works. Try it. If it doesn't work, you can walk away. I always guarantee it'll work for you. It works for me.
Definitely works for him. And what would you say makes your office unique?
We have a ton of experience in treating neuropathy, Sam. That's the only condition we treat. It is our sole focus, so that's what we specialize in. I've been in practice for over 20 years, and really what makes us unique is the experience and then the approach. It's this comprehensive approach that I feel is the way for patients to get out of the situation they're in when they have neuropathy.
Yeah, we have just a couple of seconds. So what kind of are your typical results that patients experience?
Absolutely. So typically what we'll see in the beginning is pain usually improves a lot quicker than what we call paresthesia. So like that burning, sharp shooting pain, that stuff will start to decrease a lot quicker than numbness. Numbness will improve, but it just takes a longer period of time. So usually we see improvements within the first week or two of treatment, and just a steady improvement over time.
That's wonderful. Yeah. Thank you so much for coming back to the show. We appreciate it,
Absolutely.
Dr. Dean. And the first 12 people to call 720-881-9749 today will receive a free consultation, which is a $245 value. The consultation includes a review of your health history, a neuropathy-specific evaluation, and a review of past records to determine if you're a candidate for treatment. That number again is 720-881-9749 or visit denverneuropathy.com. Dr. Dean Anderson paid for today's segment. We'll be right back.